So hi guys, welcome to my channel. My name is Dr. Nitish Gupta. I am a oral and maxillofacial surgeon. So आज जिस टॉपिक के बारे में हम बात करेंगे that is extraction of a multi-rooted tooth. So many times you must have gone through a situation in which you have tried to extract a grossly decayed upper first molar or the second molar, and many a times the crown gets broken. So we are in a very difficult situation at that time, because multi-rooted tooth after it is crown is broken, it becomes quite difficult to extract it in toto. Okay, so for that such cases we need to do some surgical intervention or minor transalveolar extraction we have to do, in which we have to place some cut between the roots so that roots get separated and we can take them out individually. So I'll explain you regarding that procedure. First molar will be have three roots, two buccal roots. Okay, the mesio, the distobuccal, the mesiobuccal, and the palatal root. Okay, so if you look it from the occlusal side, it will be, if this is the buccal side, it will have two roots like this, and this will be the palatal root. Okay, so once you have attempted the extraction using your normal molar forceps or your Cajon forceps, but your tooth is not coming out, then that is indicates that this tooth will require now a surgical intervention, that is called as transalveolar extraction. So what you have to do, you have to section these roots in such a way that all these roots which are joined together should be separate. So once these roots become separate, it becomes easier for us to remove these roots individually. Okay, so the cut we use by using our surgical burr, we give it a wide shaped cut. Okay, so what we have to do, first we have to, in between we have to give a straight cut using our burr, and a second cut in this direction between your buccal roots. Okay, so what will happen, these two cuts, all these three roots will become separate, and it becomes easier for all these roots to come individually. Okay, so once you have given a surgical cut like this, you can engage your coupland elevators from this side or from between. Okay, so that these two roots become separate. Okay, and once these two roots gets luxated, you can pull each one out. Okay, and once both the roots are out, with the third palatal root, either if you are able to get a grip, you can use a bayonet forceps to get a grip around this and pull the palatal root out, or similarly you can engage your coupland here to pull this root out. Okay, so this is the way of removal of a multi-rooted tooth. So if there is sometimes a second molar is there, you can see like this, and there will be another root like this. So this will be a palatal root and this will be your buccal root. So what happens in this case, the occlusal anatomy will be look like this. So one root will be here and one root will be here. Okay, so this is your buccal side, this is your palatal side. So in this case you need not to do a Y-shaped osteotomy or the Y-shaped cut. Okay, this you have to examine from the RVG or your X-ray, what is the root morphology in the X-ray which is shown. So if it is two roots, okay, one is buccal, one is palatal, you are supposed to give just one cut that is in between. Okay, and once this cut separates these two roots, you can take it out one separately and one separately. Okay, so that's why reading an X-ray is very important, so that we know what is the morphology of the tooth and the root. Okay, so that we can choose which osteotomy or the which cut we have to place. So if it is three rooted tooth, then it is better to give a Y-shaped osteotomy, and if it is two rooted, the buccal and the palatal root is there, then just one cut is sufficient so as to separate these two root, and you can take it out individually. As per your convenience, you can use your instrument. I commonly use Copeland's elevator, especially the angled one. ओके सो गाइस, आपको अभी देखा आपने कि कैसे आपको मल्टी रूटेड दांत निकालना है, स्पेशली व्हेन क्राउन गेट्स ब्रोकन. अभी आपको कोई डाउट हो या कोई क्वेश्चन हो, आप प्लीज़ कमेंट्स में आप मुझसे पूछ सकते हैं. आई विल डेफिनेटली ट्राई टू हेल्प यू गाइस. और थैंक यू सो मच. इफ़ यू लाइक सच कंटेंट, यू कैन सब्सक्राइब टू माई चैनल and kindly share such informations with your colleagues.